To this now, a milk bank has opened at Rahima Moosa Mother and Child Hospital in Johannesburg. Now, this initiative is expected to provide breast milk to newborns in the intensive care at the hospital. Now, this partnership between public and private healthcare has been welcomed by many. Let's speak now to Verena Bolton, Netcare and Nxalisa National Coordinator. Thank you so much, Verena, for your time this evening. I mean, let's talk about this initiative. It's quite heartwarming, and I wonder how the idea came about.
Thank you so much for having me on the show. So milk banking is not new. The first milk bank opened actually in 1909 in Europe, and America followed after that. So milk banking has been around for a very, very long time. South Africa started with milk banking in about 2006. And in 2017, Netcare decided, after a 10-year period of joining with the South African Breast Milk Reserve, to in fact create their own milk bank so that we could secure stock of donor breast milk for our babies, as well as to provide milk at no cost to babies in the public sector. And so we started with our milk banking in 2017. We in fact had an initiative with Rahima Moosa in 2019 where we just provided them with donor breast milk. But we always wanted to grow the initiative because we do know that if you have a milk bank at a particular hospital, the breastfeeding rates go up. And so milk banking, is just seen as a way of not only improving the health of the babies who receive the milk, but to just generally increase the health of the population. So it's really our aim to try and improve the breastfeeding standards in South Africa, or the percentage of babies who are breastfed, because it improves their health. And then obviously to reach out to the most vulnerable babies and provide them with donor breast milk. And so we have this fully fledged breast milk bank at Rahima Moosa. We are recruiting donors. They do a vast amount of deliveries, and so it's a really good source for us to tap into that community to help that community.
Let's talk about the donors, because I'm sure someone is watching tonight and wondering how this entire process actually unfolds and if they can be a part of it.
Absolutely. So being a breast milk donor is not very different to being a donor of blood. The processes are very similar. They are regulated by the Healthcare Act because it is overall a human tissue. So our donors complete a screening questionnaire, and we look at their lifestyle, and they have to be successfully breastfeeding their own baby and have enough breast milk. We don't want to be in the situation where we're using milk and the mom is running out. So we very, very carefully manage what a mommy is giving us. We then send her for tests, routine tests, and our processes are very, very regulated by the Human Milk Banking Association of South Africa, as well as the NICE guidelines, and then, the South African regulator who controls these things. And that's really it. We interview the mother, we have a chat to her, and I think I've answered that.
Sometimes, pardon me, Verena, sometimes people don't understand why certain initiatives are quite critical, and especially the one we're talking about right now. And you've hinted, about how it improves the health of the baby, but somebody sometimes may not understand how much of a lifeline this actually gives a child who's in intensive care, or a baby who hasn't had probably their digestive system fully developed.
Yeah, so that's a very, very important question, because breast milk is good for every baby, but it's vital and life-saving for preterm babies. Antibodies are transferred from a mother to a baby from about 30 weeks onwards. That is how babies initially get their immunity. And then when they start suckling, they get antibodies from their mom. So when you're born at 26, 27, 28, 29 weeks, even 32, 33 weeks, you've had an incomplete antibody transfer, and you have absolutely no immunity. And of course, ICUs are, there are complications when you are in an ICU. So we are trying to shore up their immune system by giving them this breast milk. And so it's essential for very preterm low birth weight babies. They have no immunity, they are at risk, and they cannot digest food adequately. So, a small baby, we're going to give them 2 or 3 mils of breast milk every 3 hours. And that, with its antibodies, is what prevents them from getting an opportunistic infection, which, because they have no immunity, they are so at risk for.
And there's something else that, when I was really thinking about an initiative like this one that, we may miss. And this is an opportunity, for example, for a mom who may not have the money to be able to travel to the hospital to breastfeed their baby each and every single day in order for them to get these nutrients. And I suppose this also goes a long way to assess that particular mother.
You are right. Logistically and in the very poor population, they're not able to travel backwards and forwards. And even, some of our moms are wanting to express at home and store their breast milk. And this is not only moms who don't have fridges and freezers, but, with load shedding, it's also been a bit of a challenge for moms who can't travel. Even if they have a fridge or a freezer, they can't keep their milk. So the donor breast milk bank does step in there. And I think what's important to note is because these babies are so small, we can feed them for a long time because they are in such small volumes. But also, we don't charge our babies, whether they're in the public or the private sector. They receive the milk at no cost because we know they're going to be healthy, and ultimately their hospitalization costs are tremendously reduced because they go home earlier, they have fewer infections, and they are healthier when they go home.
What a heartwarming initiative. Thank you so much, Verena, for talking to us. And I certainly hope, you do get a bit more donors. And this is one of those initiatives that's really heartwarming. That's Verena Bolton there, now Netcare Nxilisa National Coordinator.